Cardiovascular disease is the #1 cause of death in the United States. But heart disease has been declining for years, and many doctors believe that's due in part to the widespread use of statins to reduce cholesterol levels. 64-year-old Joyce Enright has been taking them for 7 years.
I just couldn't get it under control by myself, so it was time.
Joyce's risk factors made the decision to take statins pretty clear, but previous formulas for determining who needs medication to lower their cholesterol tended to overestimate heart disease and stroke risk in some populations and underestimate them in others. The new guidelines seek to fine-tune the medical decision-making process.
Instead of looking at numbers and 10-year risk, which we still are going to do, these are tailored to the person sitting in front of the doctor.
It's not as simple as what's your cholesterol number. Other factors to take into account include previous cardiovascular disease or stroke, family history, diabetes, smoking, obesity, physical activity, and more. If treatment is needed, the first choice remains a statin such as Lipitor or Crestor, which are sold as generics for a dime a day. If the statins don't lower cholesterol enough, other meds should be considered, including the new and very expensive drugs called PCSK9 inhibitors. The harder decision is for patients who don't have evidence of heart disease. It may be unclear whether they need medications. In that case, a calcium scan of the heart could be the tiebreaker.
That looks for calcification in the arteries, and once we have that, then your risk of heart disease goes up, and then your doctor would most likely want to prescribe a medication.
So some people with seemingly normal numbers may still need medications because they have other risk factors. Again, personalized decision making. The goal is to lower your risk of heart disease rather than wait for a problem to start treatment. And as always, this is that conversation you should have with your doctor.
Exactly.
Thank you, Dr. Max.